conditions we've been focusing on for this month. So as always, a disclaimer, this is not medical advice. If you are concerned about any of these issues, please talk to your doctor directly. These people's experiences do not represent everyone with their condition. We just are getting a small sampling of what individual people experience in their day-to-day lives. So, if you haven't already, you can follow us on our social media. We are sign up for our email, find all of our presentations there. We have the full-length versions with all the details. So if you missed any of our presentations, you can find everything we talked about. We also have a group me now. So join our group me if you want to stay in the loop of things going on, whether that be different events or if our room changes, things like that. And yeah. So, and if you have any questions throughout this presentation, you can scan this QR code and ask questions on our Padlet. They're anonymous, so we will not see who asked them, and we can refer to them at the end of the session with the guest speakers and get any questions that way if you'd like them to be anonymous. Otherwise, you can put them in the Zoom chat as always. But yeah, so today we're going to focus on Crohn's disease, gastroparesis, and celiac disease. And we're just going to briefly go over the takeaways we had from our meeting 2 weeks ago. So IBD refers to disorders involving chronic inflammation of the digestive tract, while IBS involves a collection of symptoms. So IBD is more specific than IBS. Crohn's disease can affect anywhere along the gastrointestinal tract and can be found in between healthy areas of tissue. So there can be gaps of good tissue and bad tissue. Gastroparesis is when the stomach's mobility is slowed down or doesn't work entirely, which causes a lot of different complications like keeping food in the stomach for too long and causing blockages. Celiac disease is an immune response to eating gluten, which is a protein that can be found in barley, wheat, rye. And having a gluten allergy and celiac disease are different things. So just to note. Also, as always, do not judge others based upon what you can see. You can never know what someone is going through just by looking at them. And that's kind of the whole motto of our club. So with that, we have 3 guest speakers today. We have Christina, Michelle, and Marissa. Each person is representing, I guess, a different disease that we're focusing on. So if you guys want to do a brief introduction of yourself, if you want to say what you have, your name, and just, I don't know, a fun fact or share whatever you want. And we can get started into the questions.
Okay, well, I'll go first. My name is Christina, and I have gastroparesis caused by Ehlers-Danlos syndrome.
Oh, do you want to go next, Michelle? Or
it doesn't matter. I'm Michelle, and my son Joseph has celiac. My husband has colitis, and I've had various gastrointestinal things with gallbladder diverticulitis. And we also have another son who's celiac as well, but does not admit it. And we're all gluten-free here, which helps greatly. So some of us have the celiac and some of us just have a gluten intolerance.
My name is Marissa. I have Crohn's disease. I think kind of similar to some of you guys there. I'm on the patient side of things, but also I'm in med school, so I'm a bit on the provider side too. So I kind of get to see both of those.
Nice. So I'm unmuted now. Okay. So if you guys want to start off, like, what is your experience with gastric conditions overall? If you don't mind sharing anything about your journey. I know for one, like I was initially diagnosed with like IBS, and then I got more specific with things. Do you have any experience with other gastric conditions or the one that you're talking?
So I was diagnosed with gastroparesis in 2011, and I went through the gamut of like medications and anti-nausea medications. And I ended up with a gastric stimulator, which helped a little bit, but not enough. So then I also had a pyloromyotomy, which is where they permanently open up the pylorus of the stomach, hoping maybe that would help but it still wasn't enough. So I'm currently meeting with a doctor from the NIH for a drug trial, and I started IV Zofran recently. So hopefully, fingers crossed, we get somewhere with symptom relief.
I'm mostly talking about my son Joseph. He was just diagnosed with celiac around 5 months ago, and he's been gluten-free since the week after he was diagnosed, or at least got the antibody tests before the endoscopy. He was having symptoms of stomach pain after every meal, not really wanting to eat very much, losing weight, and then he fell into depression and anxiety. Although, like I said, I've been gluten-free for more than a decade because I had my own issues, including with gallbladder. I recently had a very severe case of diverticulitis that put me in the hospital, and I had my sigmoid colon removed in the terminal ileum. So I've had my share of gastro stuff, and my husband has had colitis since he was like 12. And I found over a decade ago that going gluten-free actually helped me. I don't know if I'm celiac. Unfortunately, I did not test before going gluten-free. And the same with my husband, who is having a lot of issues. I finally convinced him to go gluten-free a few years ago. It helped him greatly. However, he never got tested to see if he was celiac, but then another son of ours has tested positive for antibodies. And my daughter, one of my daughters has tested positive for the DQ2 celiac gene, which gives her an 80% chance of developing celiac. So presumably all my kids have that gene, because obviously it's a genetic test. So I'm assuming they all have pretty much the same genes. So that's kind of where we're at now. So we're kind of trying to become an exclusively gluten-free household, which is not completely easy, but I do have 6 kids total. So some of them are on board and some of them are not. So.
Yeah, from personal experience, I know how difficult it can be going completely gluten-free.
Yes.
What about you, Marissa?
So I started having digestive problems back in like 2008, 2009 when I was in middle school. And like Stephanie, kind of like the first thing that people gave, they're like, all right, well, like IBS makes sense. I ended up having reflux disease, which down the line, when I found out I had Crohn's, I found out I had a couple of other autoimmune diseases, and one of those was causing the reflux disease. Then back in 2015, from like 2008, 2009, it progressively got worse until like 2015. I got extremely sick and started going for a bunch of testing, and they considered everything like, oh, maybe it's an ulcer in the stomach or the duodenum. Okay, that's not it. Okay, maybe it's a gallbladder issue. Okay, that's not it. And then after like enough tests, finally found some damage in the duodenum combined with off the chart inflammation numbers and a family history of autoimmune diseases. They were like, okay, what do you know about Crohn's disease? Because we think this is what you have. And it's been Crohn's since then. That's like the solid answer.
How about you, Christina?
Is my volume working?
Yeah.
Okay, perfect. So yeah, with the gastroparesis, I was diagnosed in 2011 with a gastric emptying study, and over the years it has progressed. So my gastric emptying study showed 80% remaining at the 4-hour mark, when 10% or less is normal. So because of that, I have a central line that I do IV fluids with and IV medications. So it has been very difficult, though, very difficult journey with surgeries and med trials and trying to figure things out. So, but at first they, of course, did think that it was IBS. And then after the symptoms kind of didn't match up and the meds didn't work, they were like, you know what, let's do a gastric emptying study. I had never heard of gastroparesis before. I was in high school. And so when the test came back positive, I was like, happy I got answers, but kind of scared because I had never heard of it and didn't know anybody with it. So
Yeah, very understandable.
Yeah.
Can you explain what a gastric emptying study for those who don't know what it is?
Yeah, so it's a test. Mine was 4 hours, and I've had 4 of them, and they all included eggs, toast, and water. And the eggs have a radioactive tracer in it. And you can either lay under a scanner. Some of the scanners are done standing, but you have images done. Mine was done 20 minutes, 1 hour, 2 hours, and then 4 hours. And then they can track the tracer as it's going through your digestive tract. And so that's how they can tell what percentage is remaining in your stomach based on the tracer amount.
Nice. Thank you for sharing that. If anyone else wants to talk about what has been the worst symptoms that you've had to deal with, or in like Michelle's case, your son has had to deal with in regards to like celiac, Crohn's, and gastroparesis. When did you start experiencing symptoms?
I can go. So like I didn't realize at first, even like being within medicine, how much Crohn's, as well as ulcerative colitis, the other IBD, affects more than just your digestive system. So initially, when it got bad in 2015, I had excruciating abdominal pain. I had a lot of difficulty eating. I became anemic because I was not absorbing iron the way I was supposed to, and kind of just accepted all of that as like, okay, like this is what it is. This is the worst it's going to be. And a couple years after that, I ended up developing arthritis that's linked directly to the Crohn's symptoms. So when the Crohn's is under control, no arthritis at all. When the Crohn's is not under control, arthritis like I'm an 80-year-old. And I think that's been a really difficult one to kind of process because nothing really fixes it other than getting the Crohn's under control. So it kind of feels like a 2-punch of like, all right, it wasn't enough. Like, you know, it's the gift that keeps giving. It hit the whole digestive system and now it's hitting other things. And one, I guess, last one, like most all encompassing is fatigue. I don't know if it's the not getting enough nutrients or the combination of all the different types of pain. It's exhausting. And it, you know, you want to be able to function and go about your day-to-day life, and have the energy to do it. So I always find that one, I think, the most stressful overall.
For sure.
I think for Joseph, if I look back, there probably have been symptoms of celiac all along in his life, but nothing, I guess, too serious that, you know, it would warrant like, you know, doing a lot of research and trying to figure out what's going on. But just about 6 months ago, I mean, he was complaining that his stomach hurt pretty much all the time after eating. And the worst part of it, though, I think for him and for us, is he was just our very happy-go-lucky kind of jokester kid who always was involved in everything and always wanted to go everywhere and do everything and just loved being around people. And he just started isolating himself and not talking to anybody and just not even understanding his own feelings, but really, you know, falling into that whole depression. And we're like, what happened to our child? And this, I mean, I know that he's a teenager, he's 15, and I know that sometimes these things happen in the teenage years, but this was a very sudden changing of like his entire personality. All of a sudden and there was nothing going on. So that we knew, and when we asked him, is there something going on that we were not aware of that's outside of the house or something that is, you know, bringing you to this state? And he didn't understand his own feelings and what was going on. And obviously with the celiac, and when he was tested for celiac with the endoscopy, he was at stage 3. And so quite a few nutrients were not getting absorbed at that point. His vitamin D was very, very low. A bunch of other nutrients were very low, which of course would all contribute to the depression. But the depression was definitely the worst part. And he said so himself. The stomach pain, he just learned to deal with. You know, he just learned to live with it day after day after day. But the depression just came out of nowhere with him. And he didn't know what to do with that. And we didn't know what to do with that. He just wasn't the same child.
Yeah. I would say like the hardest symptoms dealing with gastroparesis and the ones that I kind of first started noticing were the nausea and the bloating. Since the food sits in there for so long and tends to pile up, like you eat your breakfast and instead of digesting, it stays there. Then you eat your lunch and then it just piles on and piles on throughout the day. So I'd say the bloating and the nausea were kind of like the first symptoms I started noticing. And then as time went on, those just started progressing and getting worse. And then the vomiting started getting worse. When I was still working, I'm not working right now due to my health, but I would throw up sometimes 11 or 12 times a day in the office, just having to go back and forth to the bathroom from my desk. So I think those are the main worst symptoms. The early, like getting full really early is another one that started getting worse as things started going on. And just the nausea, vomiting, and bloating is just, those are my main four, I would say.
Yeah, that's definitely a good main four. So some of you have already touched on this, but what was it like getting diagnosed? Like, what was the process? Like, how long did it take to get appointments in between? If there were appointments in between, like, was this like thing that took you multiple years to figure out, or how did that go?
For my diagnostic process, luckily it was quick, like compared to a lot of other people I've spoken with. So I got diagnosed by a local GI doctor here in Knoxville. And then for years, it was semi well managed. And then it started getting worse. So then my local GI doctor suggested going to Vanderbilt, which is where I go for autonomic clinic anyway. So my autonomic doctor got me in there within 2 weeks. And then they scheduled me for a G-POEM a month later. And then that doctor, since we're still having troubles with like symptom control, he recommended me reaching out to a doctor at the NIH who got me in within a week.
Wow.
So I've had a very lucky like trajectory in regards to getting diagnosed, because I know a lot of patients wait years to find out what's with them. So I think that's what's so important about advocating, because of how long it can take for people. So
Yeah, that is one of the main goals of our club.
yeah, like
Yep.
being diagnosed early is the best thing that can happen.
Yeah, for sure.
Yeah, I really don't mess around, I have to say. I mean, as soon as Joe was having issues, I don't wait for doctors either. So I order my own blood work. So I ordered, like, I mean, I Googled his symptoms. I Googled some things that I knew about his previous lab work that were a little bit out of range that doctors weren't all that concerned about, and Googled everything together and found out, okay, these are possible symptoms and lab work for celiac. And I just went and ordered a celiac antibody test right off the bat, went and did it myself. And his antibodies came back at greater than 100, which less than 15 is considered normal, and anything over 100 is pretty much a automatic celiac diagnosis without the endoscopy. So then I called a pediatric gastroenterologist that was recommended to us, and they got him in like the next week for an appointment. And that was a Wednesday. And he said, yeah, he definitely has celiac, but according to the AMA, we have to do an endoscopy, both to get an official diagnosis and to also see basically what his baseline is, and figure out how much damage has been done so they can see that it's improving. And he's like, we can get him in a week from today. So it was the following Wednesday that the endoscopy went through. And it was like the following Wednesday after that that we actually had an appointment with him to go over the results. And so it was very quick from the onset of the really severe symptoms. Like I said, he probably had, if I look back, he probably had minor symptoms that I wasn't too concerned about, and he wasn't too concerned about. But once the major symptoms hit, I don't mess around.
Yeah, definitely valid and understand. Both were able to catch that pretty quickly, relatively speaking.
Yeah.
Kind of like gastroparesis, Crohn's runs the gamut of like how long it takes people to get diagnosed, from people where they go in and damage is immediately evident and they get diagnosed right off the bat. Then it's all the way across the spectrum to people where it's not very cut and dry and it takes a really long time. And I was one of those patients for years throughout like middle school, high school, in the beginning of college, I saw a gastroenterologist and we were just going with IBS. When I got really sick in 2015, I had passed out and went to the hospital, found out I had severe anemia that kind of just got written off as like, oh, like sometimes women, you're anemic, it's fine. Which, is not helpful to anyone. But a couple months later after that, I started having really bad digestive pain. I called home and told my mom I was calling to try and see if I can move up an appointment that I had made, like switching over from pediatric to adult gastro. And they're like, we can get you an emergency appointment in a month. I was like, all right, well, that doesn't feel very emergent. I called my mom, and as moms do, she was like, no, you did it wrong. So she reached out to my old pediatric doctor, and he was like, I'll see her in 3 days, like my first opening. Went to see him, did endoscopy, colonoscopy, found nothing, got sent for a CAT scan, didn't show much. Ultrasound, HIDA scan to check my gallbladder, everything kind of kept on coming up empty. I did a capsule endoscopy, which is able to see a lot more of the small intestine than anything else, since it's not like restricted by having to be maneuvered. And that saw like just a hint of damage in my duodenum. So they had me go back in one more time and did a specialized scoping called an ERCP, where they go into like the bile ducts. And the doctor who had done that, like it's a very specialized exam. And the doctor who did that was like, listen, I'm not really noticing anything. I don't want to say it's all in your head, but like, it's probably just a functional condition, which is like kind of akin to being all in your head. We'll get you started on like an antidepressant or something that'll target the nerves. It'll help you sleep so you'll feel better. And by that point, I just felt like very downtrodden. That like, that's it. Like, I spent months feeling awful. I wore off the bottoms of my shoes because I was so tired. I couldn't lift my feet to walk. And I was like, that's all this is. A couple days later, I went and I saw my doctor, and he came in and he was in like a great mood. I was like, no, didn't you hear? Like they found nothing. Like I wasted all of our time. And he was like, no, like they just got the results back from biopsies that they did. The entire area around where a bile duct pours into your duodenum is all ulcerated. That plus the immune markers and the anemia and your family history. Like I figured out what's wrong, I think. What do you know about Crohn's? And at first I was like, oh, good, great. We have an answer. And didn't really process anything more than that, because I'd just been so focused on like, all I need is an answer, and like that's it. And then like a couple weeks later was hit by like, oh my God, I thought I was gonna have something like, answer it, treat it quickly, move on with my life. And instead it's kind of this life sentence diagnosis that still really did stick for a couple more years, because he didn't feel comfortable prescribing any heavy duty meds. So I went on low scale ones without many side effects. I did almost a year on methotrexate, like a low dose chemo. Had really bad side effects, not much improvement. And finally, then I officially got pushed to an adult GI. And my rheumatologist at the time was like, listen, she now has arthritis caused by IBD. You can't have that without an IBD. This is it is Crohn's. I'm going to give her the med she needs. Is everyone on board? If not, too bad. I'm giving it to her anyway. Thank God for her. And after I went into remission with that drug, they're like, all right, well, that wouldn't have happened if it weren't Crohn's. So it was like the official like stamp. Congratulations, you have Crohn's. It only took a decade. So yeah, sorry. Long story, not short.
Okay, what are some things that make your conditions worse, and what make things better? If that
Eating. No, y'all, I'm serious. Oh my gosh. Yeah, eating, drinking, taking medicine. I guess things that make it better. Medications would be the only thing I can think of. Like eating very easy to digest foods, very small amounts throughout the day. But yeah, it's a struggle trying to figure out what makes it better and what makes it worse.
Honestly, same. Rests are like no fun, but also like having that little bit of break, living off of Ensures and anything that'll just like not aggravate things further is stellar. And yeah, unfortunately, really the only tried and true is like, if you can hit remission with medication, it is stellar. I had remission for like 15 months.
Oh my gosh.
And like it was great. And now I've been out of it for 3 years and it has been not great. So you kind of just like keep chasing that. All right, eventually something else is going to put you back in it and things are going to be better.
It's just eating gluten-free for Joe. So
Yeah.
although I think that until his small intestines completely heal, which they said about 6 months, so he's close. So we'll see. I mean, he does lay off most sugar and dairy as well as the gluten.
Do they do like another endoscopy to see how much damage is left? Like
I think they will do another endoscopy. I think they said it 6 months maybe. So we'll see if he schedules it to see where he's at.
We kind of touched on this, but what treatments have you tried? What's worked? What hasn't worked?
I've tried Reglan, which is like it's kind of the first medication they try when you're diagnosed with gastroparesis. Unfortunately, I started having too many side effects from it. So then they switched me to erythromycin, which just happens to be an antibiotic that has the side effect of increasing motility. But you can only stay on it short term without it losing effectiveness. And I was on it for a little bit too long because my other GI had retired and my new GI was like, we've got to take you off this. I'd been on it for like a year and a half. So he was like, we've got to pull you off this. And it started losing its effectiveness anyway. And then I tried Bethanecol, which is a bladder motility medication used off label for gastroparesis. Unfortunately, it didn't help. Motegrity, which is a medication for chronic constipation, also used for gastroparesis. It helped a little bit more than the others, but still not enough. And then I'm currently on domperidone, which is a medication that's technically not FDA approved, but you can get it through an expanded drug access program. So luckily that helps some, but I started having really high prolactin levels from it and started having issues with that. So Vanderbilt doesn't want me to stay on that long term due to the hypoprolactinemia. So that's why we're looking at a drug trial. We're looking at IVIG trials for it. And then I'm currently on IV Zofran every 8 hours. Phenergan as needed and Compazine as needed. And then I have the gastric stimulator. So.
How about you, Marissa?
So I started with mesalamine, which is more of an ulcerative colitis medication than a Crohn's medication, but it's often like cross-used. It doesn't really do much on the Crohn's end other than like decrease how many times a day you have to run to the restroom and how long you have to run there. So it's useful, but it's a lot of very large pills, and for something that doesn't do much, I didn't love it. Then I moved to methotrexate. It helped a little, but the side effects were too much to justify. Then I was on Humira, type of biologic, which targets the tumor necrosis factor or anti-tumor necrosis factor. That was great. I loved being on it. If I could have stayed on it any longer, I absolutely would have, because it's the only one that I've gotten remission with so far. But unfortunately, your body kind of, in its efforts to self-destruct, just gets smarter and smarter and learns to target the drug. So once that happens, it's not, you can try and either increase the dose that you take to see if it's able to overcome the antibodies. So we tried doing that and it wasn't enough. Then the biggest enemy, honestly, besides my own immune system, became insurance companies, because I started on Remicade infusions, and I'm originally from a very like suburban near urban area. I moved upstate to a rural area for med school where they didn't have things like at-home infusions, which cost much less. So the insurance companies love them because less money for them. So they insisted I do that, and there were none. So it was impossible to get that care. And they were like, well, you know, that's what we're going to pay for. So that's what you have to make work. Could not make it work, did not exist. So I went a really long period of time without getting my medication, and it stopped working. We kept trying for as long as we could, because once you stop a drug, the odds of being able to go back are very slim. But finally they decided like, all right, no, like this isn't working. Let's switch to something else. So I started Stelara. which is only the initial thing is an infusion, and then all the rest are shots you do yourself. So we figured, all right, like unless the mail system messes up dramatically, there's no way loading dose infusion, and didn't realize they were also supposed to be approving the maintenance dose shots. So you're supposed to have 8 weeks between the infusion and your first shot, and I had 20 weeks. And if you mess up that period, it doesn't really ever give the drug a chance to work fully. So I had the infusion in July of 2021. I started maintenance in December of 2021, and we've been continuing it still. We moved it, usually it's every 2 months. They went off label to do every month, and I'm probably switching to a new medication, undetermined, within like the next 2 months if it doesn't improve, which it as needed Zofran, as needed Imodium, stellar, very helpful.
Yes.
Joe
And-
is not on any medications. He's just eating the gluten-free diet. And it is working. There's more good than bad days.
Yeah, and that's really all you can do with celiac,
Yeah,
to be
yeah.
honest. So, what has your conditions or condition changed for you? Like, how have you changed your life to accommodate it? Like, what has it affected? Can you no longer do some things you were able to do? Or are you able to manage? Just things along that realm.
I would say like it's obviously changed like what I can eat and what my diet has been. Like I really miss tacos. Like I was thinking the other day, I was like, gosh, if I could eat a taco again, I'd be so happy. But it's also affected my ability to work. I think like having the combination of like the gastroparesis, and I have POTS as well, and the EDS and all of that, I've been unemployed for about 1.5 years. Just because when one thing would flare up, it's like everything would flare up. So I think that's what has changed my life the most in regards to the conditions, like just not being able to be employed right now.
Yeah, for sure. That's a major thing. How about you, Marissa?
I think for me, one of the biggest things is just like the amount of planning that has to go into things that never would have to before, like even coming on this call, like plan out like, all right, what time am I going to eat? What am I going to eat? How far enough away? Have I run to the restroom enough times beforehand to make it through and like not have to leave in the middle? And that's like every morning when I leave, I said before, I'm a clinical medical student, and on my surgery rotation, like that was a daily panic of like, okay, like how much can I hydrate or eat before a surgery that I'm not going to be passing out if it goes too long, but also like I'm scrubbed in, I can't run to the restroom. Like, what do I do? And it was just this constant like panic and anxiety of, oh my gosh, like I can't function the way I should be able to in an environment that's very competitive and very like you need every edge and advantage you can get. I guess slightly tied into that, like my biggest fear when I first got sick was, I want to be a physician. What am I going to do? How am I going to make it through med school if I'm sick? So my biggest fear was like doing med school, not in remission. I made it like 1 month in without really active disease, and then all hell broke loose. So just like having to take into account, like, I don't know, I'm doing all right enough, but I don't know how much better I could be doing if I were still in remission, and like kind of having to grapple with that too, like adjusting plans, I guess, for myself, and like the vision of like how I thought things would go has been pretty big.
For sure. Well, and we know for he can't eat what he used to.
Yeah.
But-
And well, it's just an aside, just with my own gastrointestinal health, I have to, what is the word? I'm missing a word, but I'm going to agree with Marissa. Like, I mean, I just for this call, I had to kind of do the same thing. Like, when do I eat? When do I go to the bathroom? When, and I spend, just kind of as an aside, because I know we're talking about Joe and celiac, but I fast a lot because if I have to go out, I cannot eat or I might not make it to a bathroom. I might not find a bathroom. And so if I know I have to be somewhere, then I just don't eat. So, but anyway, with Joe, I know it's difficult because he has to bring food with him all the time, wherever he goes, because nobody's really looking out for him to make sure that everything is certified gluten-free. So it changes a lot of the social situations. So, you know, after his band concert, they go to Portillo's. He's like, can I eat anything at Portillo's? And I'm like, not really. I mean, even a burger without a bun, according to the Find Me Gluten-Free app, it's not a celiac friendly restaurant, and it has a very bad safety rating. And so he makes a gluten-free sandwich, and he's always carrying his little lunchbox, you know, with him everywhere he goes, if he knows he's going to be out and he's going to be hungry, or he grabs a protein bar that's gluten-free and keeps it in his pocket in case he ends up being out later than he expects, very hungry, he can't eat anything that's around him. So thankfully he actually was very accepting. He was just happy when he got the diagnosis. I was so nervous to tell him. I didn't want to have to tell him that his entire life was changed for forever. I mean, he can never eat anything with gluten again. But he was in so much pain and didn't understand what was going on with him. He's like, when I said, so what do I have to do? And I said, you have to eat gluten-free for the rest of your life. And he's like, that's it? Great. You know, so he's been great with it, but I know it's difficult. Just always planning ahead is hard, and not being able to participate if everybody's having pizza or everybody's at Portillo's or, you know, going out. Then there's like, I don't know, 3 restaurants so far that we found that around here that are actually have a 5-star safety rating and are well versed in celiac and being having the, you know, dedicated gluten-free area of the kitchen and gluten-free fryers. And so it changes all of our lives, because we can't just pick up and go out. I mean, so we have to do a lot more cooking at home, which means obviously there's more planning ahead, making sure that we have food to make, prepare, to defrost, and, you know, to have the time to make the food. And so can't just say, hey, let's order pizza tonight. It's just not that easy. So
Yeah, for sure.
And it's also a lot more expensive.
it is a lot more expensive. Yes, it is. Yeah.
So what advice would you guys give someone who's newly diagnosed with the condition that you have? What would you want them to know, do? Just any general advice?
I would say if you're comfortable with it, just letting people know what you're going through and being open as much as you feel comfortable, and also connecting with others online. I think that's been a lifesaver for me, especially after I had to quit my job. Joining, as of all things, TikTok helped me mentally so much to connect with people. And now I have friends all over the country with the same conditions I have, and we text each other daily and just see how each other's doing. So I think that just making sure you connect with other people who have it, maybe even joining like support groups on Facebook or support groups in person, if there are any. Those are the things that I can think of that have helped the most.
Definitely agree with that.
I think I would tell anyone newly diagnosed to process it at whatever, take as much time to process as they need, process it, come back to it. Unfortunately, because these conditions are typically lifelong, and they change as you change and follow you through stages, having to process it and adapt happens over and over and over again. And that's not something I was really prepared for at first. So, early on, anytime like a new setback hit or like something else changed, it hit so hard, and I would get so upset with myself for not oh, it's been like this, for years. Like, why are you not used to it by now? And every time something changes, a bunch of other things in your life could be different too. And it's okay to, even when you feel like you're used to it or you have things kind of handled, it's okay to still have the days that are worse than others, that you have more difficulty. And it's not a problem with processing or a problem that oh, you're not strong enough to handle the thing. It's just having invisible illnesses is really hard, and that deserves all the grace that we can give ourselves and understanding to just be okay with this is a hard thing and I'm dealing with it every day, and that alone is awesome.
Yeah, definitely. One of my friends recently was talking about how grief, especially with chronic illness, is a cycle.
Mhm.
Yeah. How about you, Michelle?
Definitely advocate for yourself, advocate for, the patient. I advocated to see a nutritionist, even though I had been gluten-free for a decade. I was not familiar with celiac. I didn't worry about cross-contamination. I just worried about lowering my gluten intake. And, but with Joe, I wanted to make sure I'm doing everything right. And I know the gastro doctor was like, you don't need a nutritionist, just Google, And I said, no, I think that we need to see a nutritionist, so you need to refer me to a nutritionist. So we did see the nutritionist, and she was extremely helpful. And of course, in the middle of telling us lots of different things and stuff that I did not know, she also said, don't rely on Google to give you the right answers, because there's a lot of misinformation out there. I said, that's funny, because the gastro doctor told me just to Google it, and he said I didn't need a nutritionist. And she was like, he didn't say that, really? And I'm like, yeah, unfortunately he did. But so that was extremely helpful. And like Christina said, definitely joining support groups and getting support from other people. We happened to notice at church a couple of weeks after he had been diagnosed that there was a family in front of us who had brought their own communion hosts to church. So after church, I was like, hey, are you guys celiac? And so then we had a conversation and exchanged numbers, and they had been, it was a whole family of celiacs. And so they had a lot more experience than I did with it, even having been gluten-free. So I was able to pick her brain. It feels good to be able to, join with other people and share that experience and know that you're not alone, like Christina said.
Yeah.
And you can get through it.
Yes, that's a big one. Kind of last kind of combined question. If the public were to know one thing about gastro conditions or your condition specifically, what would you want it to be? And same for physicians. If you had every doctor know this one thing about your condition or just gastro conditions overall, what would it be?
Oh, my number one would be BMI does not equate to what your nutritional status is. I once had a doctor tell me that when I lost 17 pounds from vomiting after a week and a half, he said, good, you needed to. And I mean, I'm sorry, what? Like, and I finally have doctors now who understand, like, hey, like the doctor I met with from the NIH was like 2/3 of gastroparesis patients are actually overweight because some of the safest foods for them are carb heavy. And I was like, thank God I finally found someone who understands. And my doctor at Vanderbilt, he understands too. And it just, the BMI has nothing to do with it. The NIH doctor was like, you are mildly to moderate, malnourished. And I was like, whoa, like my BMI is above average. And so to hear that was very validating to understand that, hey, they're taking me seriously, that this is actually really impacting my life, even though the scale is, my numbers are above average. And then in regards to what like regular folks think, how much goes on behind the scenes to actually live our daily lives. Like if you see someone with a chronic illness out in public, being able to go maybe to an event one night. What did they do to prepare for that event? Did they take naps throughout the day? Are they going to be flared up for the next week because they went to that one event? So don't assume like that they're healthy or that they're lying or that they're making it up or that they're exaggerating, because we really put in a lot of work to be able to do the one thing that everybody else can do.
Definitely.
Crohn's has the BMI and like carb heavy issue too, and it's infuriating. The biggest public thing I think I would say for all, like across the board, but also kind of Crohn specific, a lot of the like knowledge that people have about many of these conditions comes purely from like what they see on a commercial for drug advertisement. So the telltale Crohn's one is like a bathroom door, and it just constantly like emphasizing like people with these diseases run to the bathroom a lot. And it's so much more all encompassing than that, as are really any other invisible autoimmune chronic condition. So like making sure that people know like yes, commercials and like the one-offs you see somewhere might reduce all of these conditions to like this one thing that might not seem like it takes up that much of a person's day or their life, but like most of the, if not all of these diseases are very all encompassing and hit on all areas of life that other people would never even imagine being impacted. So just like taking that into account, kind of like what Christine had said, like it makes you, like we have to take so much more into account and there's so much more that goes into daily things, and it's important for people to recognize that and kind of like appreciate that. And then for healthcare providers, they're decreasing the amount of time that providers see patients, like to such a small amount, it's not feasible to understand what's going on with patients. And unfortunately, sometimes you're having a good day or like a good 15-minute bout. And so you go in to see your provider, the once every couple months you get to see them, and they see that and they're like, oh, great, you know, you're doing fine. I have no concerns. And you're like, all right, well, 99% of the rest of the time, I feel awful. So I think for providers, it's really, really important to remember that they see snapshots of patients' lives, and patients live their experience every minute of every day. So like, even if they look okay, even if their lab results, you're happy with how they're doing, if they say something's wrong or like something feels not right, they're the expert on themselves. I don't care how much schooling like doctors go through, many years of training. We're not experts on individual patients, the patient is. So like, that's important to listen to.
For sure.
I would want people to know that celiac is much more prevalent than they think, and there's a lot more symptoms to celiac than, you know, the stomach pains. I mean, there are this mental illness is a symptom of celiac, anemia, bone disease, elevated liver enzymes, migraines, reproductive problems. I put a list down, and that people should, I would want the public to know that they need to get tested, because the University of Chicago Celiac Center is actually suspecting that 1 in 100 people in the world actually have celiac, and only like 1 in 4,800 are actually diagnosed with it. So, and it's a very inexpensive test. I mean, it should be, as far as I'm concerned, it should be part of routine lab work. When you go in for a physical, it's less than $100 to run a celiac antibody test. I mean, the endoscopy, obviously, if the antibodies come up elevated, is a more expensive test, but the antibody test itself is not an expensive test. So I'm, you know, I know that the University of Chicago is trying to get the word out there to the doctors, especially like, hey, it's in the past, University of Chicago says it takes in the past from onset of symptoms to diagnosis is about 10 years. It's about a decade currently, and they want to change that, and they want doctors to realize, hey, you know, there's a lot of symptoms of celiac, and if people are coming in to complain, I mean, this is a very simple test that you can get done to at least see if the antibodies are elevated before, you know, moving on to the endoscopy. So yeah, and very simple things like the nutritionist told me, which I did not realize, but lactose intolerance, and so many people are lactose intolerant, is the first symptom of celiac, because the lactase enzyme in your body exists at the tip of the villi, which are being destroyed by the celiac. So it's the first thing to go is the lactase enzyme. So if you all of a sudden become lactose intolerant, that might be, you know, a symptom. So there's a lot of things that the public, I think, needs to know, because if there's 1 in 100 people out there, 1 in every 100 people out there with celiac, you know, but they have no idea. They have no clue that that's even a possibility. So kind of scary.
Yeah, I did not know that. Thank you for sharing that. So is there any other like thoughts or things that you guys want to share, or do we have any questions either like in person here or on Zoom? I haven't checked the chat in a while.
We have one comment from Lily saying, I know feeling included when you need to eat gluten-free is difficult. I've been very lucky that the people around me, friends, teachers, family, take so much care to make sure I can eat.
Yes.
That's great.
I can also kind of relate to that. I had a few years of, as Michelle knows, Michelle's actually my godmom. So thank you for coming to this meeting. But I had quite a few years. Yeah. I had quite a few years where I was carrying around a lunchbox and couldn't really eat anything that other people could. So it's definitely a struggle to feel included and just to eat in general. Do we have any questions for people on Zoom or people in person that we haven't already covered for our guests? No? Any other comments from our guests? Or things you want to share before we end?
Cross comment. That's so stellar that Joe's like on top of taking care of it, what he can and cannot eat and going with it. I was a good deal older than him when I had to start like adjusting what I could and could not eat. And at first, when I was sickest, I had not much of a problem with it, but I went through periods where I couldn't eat peanut butter and I was ready to lose my mind. Like, so as like a grown adult. So to be a child and going through changes that big and, being so like managing his own symptoms and his own food like so well that young is really great.
He's a very mature child. And then I've got the one that has also tested positive for the antibodies, who is like, I don't have celiac, I'm not eating gluten-free, gluten-free food is gross. So it all really just depends upon personality. And unfortunately, his symptoms are not physical, and that's part of the issue, because his symptoms are all mental, and we've dealt with mental illness his whole life, but he doesn't believe he has an issue. So that's why I think I'd like the public to know that it's more than digestive symptoms, because if I had known that ahead of time, maybe I could have diagnosed him myself, like I tend to do with my family's health issues. Maybe I could have diagnosed him years ago when he was still pretty much under my thumb, but he's actually older than Joseph. He's going to be turning 17. So, I don't have much control over what he eats or doesn't eat. And it's hard, because I feel like after doing research and reading, I'm pretty sure that if you went gluten-free, a lot of these issues that you have would possibly go away. And but he doesn't see the issue, and of course he doesn't have physical pain. And when you don't have physical pain, it's very difficult to convince somebody, I think, to do what they need to do for their own health.
Yeah.
For sure. Well,
Even
thank you
with
all-
physical pain, it's hard. So
yeah, that's very true. Well, thank you all so much for being willing to speak to us and taking your time out to just share your stories and your journeys. And hopefully people learned a little bit today, if not any like straight up facts, but just that people's experiences vary, and that it can take a long time to get diagnosed, and just pay attention to people and try not to judge people, because you never know what they're going through.
absolutely.
Yeah, but thank you all for being here. Free to go. Don't want to take up too much time, but
Service dog event.
let's say what?
Service dog event.
Oh, okay. Service dog event. Sarah's always on me for plugging things. I always forget. We do have a service dog event 1 week from today in the same room that we're in right now. It will not be on Zoom at all because we're going to have a button maker. So if you want to make invisible illness themed buttons or service dog related buttons, we'll have stuff to do that this next week. Same time, same place. And we'll be learning about the difference between service dogs and emotional support animals, and how they help people. We'll have a guest speaker from Loyola talking about their experience with it. So
Yes. And it is also Rare Disease Day, so we will briefly be talking about that.
that is true as well. Yeah, February 28th is Rare Disease Day. So or 29th is always the last day of February, because it's the rarest day of the year. So yeah, well, thank you all for joining, and hopefully we'll see you next week. And yeah, thank you.